Good afternoon, everybody. Let's get right to it. We had no new deaths over the last 24 hours. 212 of our neighbors we've lost since the pandemic began. We've received 5,230 tests back since yesterday. Our 7-day rolling average has increased to 2.17%. We now have 49 individuals in the hospital. That's up 7 from yesterday. We actually had 9 new admissions. We had 2 discharges. We now have 6 individuals in the ICU. If we could obviously keep them in our thoughts and prayers. Out of those in the hospital, we have 28 Caucasian, 5 African American, 4 Asian, 1 of another race. 11 folks have yet to share their demographic information. We now have 5,930 positive cases since the pandemic began. That's up 149 cases since yesterday. Out of the 149 cases, 24 were related to a cluster in higher ed. The reality is large gatherings have consequences, whether it's college, neighborhoods, professionals, and we're seeing it everywhere. So 23 cases related to gatherings, 24 higher ed. 18 cases related to K through 12, 8 student, 10 faculty. Again, when we report K through 12 cases, if you are a school-age child, we report you if you get the virus. That does not mean you're in school with the virus. You could have been a household contact, or you could have been sick and never went to school and exposed anybody. But if you are a K through 12 age group, you get reported in our data. Looking at travel, 3 cases related to travel, 2 from the state of Montana, 1 from Maryland. It does not seem that these individuals were in a quarantine. 25 household contacts. Again, today we have 149 cases, 150 cases. We'll probably get 30 cases in the next 2 weeks from today's cases, just because they live with other people and isolating is difficult. So high cases, high household contacts. 3 senior care facilities, 3 cases still being investigated. 114 of our cases are community spread, 55 of a known source, 59 of an unknown source. We are now monitoring 709 active cases. This is up 120 since yesterday. We've had 28 recoveries over the last 24 hours. There is a direct correlation with our active cases and our hospitalization number. And so this has been the same way throughout the pandemic. And everybody, and to certainly we get calls in my office. I get people trolling me online, doing all sorts of things to say the virus isn't real. Well, there's 49 people in the hospital because of the virus. And it's directly related to the number of cases. So the more cases we have, the more hospitalizations we get. It's a fact. So right now, between 7 and 8% of our caseload will lead to hospitalizations. We've gotten better at treating our sick in the hospitals with therapeutics, which is good news. But we cannot allow these cases to get out of control and expect that people who are sick outside of COVID-19 will get the proper care they need at the hospital. That's what it's about. It's about maintaining our medical infrastructure for every sick person, not just somebody with COVID-19. So when we look at demographics, 3,296 female, 2,633 male, 766 under 19, 1,351 in their 20s, 810 in their 30s, 701 in their 40s, 834 in their 50s, 608 in their 60s, 375 in their 70s, 308 in their 80s, and 177 in their 90s. To give everybody a sense out of our active cases, and again, we'll get into some of the mitigation thoughts, but 709 active cases, 348 of them, or 50% of them, are between the ages of 18 and 40. When we look at the program moving forward, There certain mitigation, but testing has to be a piece of getting this and identifying the infection and the virus in the community now, so that we can wrap our arms around all the various clusters. Data tells us the story. Every decision we make is data-driven, whether it's where we're doing testing, how we're doing testing, what type of enforcement we're doing, what type of mitigations efforts we think make sense, whether we're talking the state or whether we're doing it ourselves. But when we look at what we're going to now be doing, on Monday, we will offer asymptomatic testing at the F-Shed market. You will need to register ahead of time for asymptomatic testing. You can go and register at ongov.net/Cayuga Medical. Anybody in the community that wants to get an asymptomatic COVID test can. It will be free. It's never free. Your taxpayer dollars will pay for it, but you're not paying for it out of your own pocket. But you do need to register for that. Symptomatic testing, you can still show up. We ask that you do register, as now it's going to get busier. On Tuesday, we will begin targeted asymptomatic rapid testing here at the On Center. Our first group of individuals that we want to work with in the community for this will be hospitality industry workers, restaurants, bars, hotels. We will put up registration information this weekend, but we will need people to be registered. Very important that our hospitality industry gets in the game here with your employees. Your employees come to work sick. Why that is, when we're asking them not to, I don't know. Maybe you can answer the question. We want to keep you open. But we now have multiple clusters in this industry where employees come in sick. They get many other people sick. We have businesses that have to shut down for a period of time. That's not good for anybody. It's not good for the employee. It's not good for the business. We're going to offer rapid asymptomatic testing. We want participation. If there's not participation, we know the industry itself isn't taking it seriously, and we'll look at other mitigation. So that will begin. We will continue our symptomatic testing at the F-Shed market for K through 12 and any employees. Again, the two ways we do this, we want people to really try to pre-register. The saliva test through Upstate at mychart.upstate.edu, or you can call 315-464-2582 to pre-register for an appointment for the saliva test, or again, ongov.net/Cayuga Medical to pre-register for a nasal swab if you're symptomatic or asymptomatic, Monday through Friday, 9 through 1. This weekend, if you are coming down with symptoms or you've had exposure to somebody with COVID, you can get a test 9 to 1 at the fairgrounds. You do need an appointment. Go to mychart.upstate.edu or call 315-464-2582. Our enforcement unit will be out in the community. They'll be looking to make sure that the businesses that have had cases or have gatherings are compliant. We've seen when people come together in a compliant fashion, we have success. Last weekend, the unit was out. They had a very good, very good success rate at the businesses. I think they only gave out one fine, and they went to at least 50 different establishments throughout the community. They will be out. Again, we need our business owners to work with us, and certainly patrons need to be good to our business owners. If we're going to be out, if we're going to be at a restaurant, we need to do and follow the rules. If we follow the rules, that will make us safer, and that will put the business owners in a position to succeed. Business owners shouldn't have to be telling you what to do and what not to do and have to push you out of their establishment. They don't want to be in that position. Don't put them in that position. We know when we go out to eat, and if we're getting an appetizer and a drink, you got to be seated. If you get up, you got to have a mask. You can't hang around the bar. We know that. It's been the rules. Don't put the business owners in a position where they have to ask you to leave, because that's what they're going to have to do. Saying that, I've not spoken to the governor yet. I saw his comments. We've looked at some of the data. We've been following the data daily. We have different concepts and mitigation efforts that may be appropriate. I'll have those conversations and make those recommendations when I speak to the governor. But certainly, this is a trend. We had 149 today. We'll have over 100 tomorrow. I don't think it'll be more than this, but I haven't gotten a final total. It's an unsustainable number not to have an impact on our medical infrastructure. You can't have 1,400 cases every 2 weeks and not expect it to impact our hospitals at some point in the future. So we need to stop it now. The gatherings that we were having in the summertime don't work anymore. And we're going to hear about them, and we're going to enforce them. And it doesn't matter where it is. You can't have large gatherings at your house. You can't have the parties. It's causing cases, and that's leading to hospitalizations. People are getting sick. And that's not going to just impact those with COVID. It's going to impact people who are in car accidents, and people who have heart attacks, people with cancer, elective surgeries. Now is the time to wake up. Saying that, I'll take questions.
When you do talk to the governor, what will you tell him about what new strategies are happening immediately and what is ahead in your planning?
I think we need more resources from. I know that the federal government's passed on more rapid testing resources to the state. I know that the state is going to give us some more. I think that's one. If you give us more resources, we can do more surgically to hunt down and box in the virus. But in addition to that, I've studied and have talked with my colleagues in some of these other zones. Some of the microcluster approach was choreographed around how to make it work in those counties, within those communities. The town of Cicero, for example, was referenced today. We have 60 active cases. Okay, so going into the town of Cicero, 60 active cases, and trying to put them under some set of rules when the town of Clay or other municipalities next to them aren't. I don't know how effective that will be, because these are random. We've looked at these. There's nothing that we can say if we go work on this that solves that problem. I do think gatherings are a problem, and that's the reality. And we've been saying this for 2.5, 3 weeks, and we haven't been getting the community response. So certainly I'll talk about gatherings with the governor. I do think there's a lot of business owners doing the right things that in other communities have been part of a problem. Here, not so much. But gatherings are an issue, and they need to be enforced.
What changes, after talking with the governor, he's obviously mentioned the micro clusters, what changes would be made first? What gets scaled back first if that has to happen? Schools, businesses, churches, events, what would be first?
Well, schools have been very safe, and the data proves it. So I wouldn't recommend schools. And when you're we weren't having problems when people were following guidelines, and when the weather was nicer, you could be outdoors, so that kind of minimizes some of the risk with the virus. We don't have that luxury. We do have that luxury this week, so people should enjoy themselves outdoors. And if you're going to go to a restaurant, go have a nice meal outside and take advantage of that. But I think what we need to do to get your arms around it is you need to find it, and it's so spread now. We want to do the asymptomatic testing, and then the rapid testing in the industries that we're seeing cases connected to contact tracing. So I think phase A is really expanding the testing even more than we already have. We've been working on it, and we have been expanding it slowly, but if we get more resources, we can do that much quicker. And I think resources will probably be part of this. But again, I think the gathering number of 50 certainly is on the table to have that adjusted going backwards.
You said phase A would be just expanding. What would phase B then?
I think the gathering number's on the table. 50 people going backwards on that number. There's ample evidence to show that when you have that many people together now, that spread is more likely.
Ryan, is it your understanding that the state now is going to identify a cluster zone here and take control of managing that, or is that still?
Yeah,
open?
even in the other counties, I think in some areas the state might have came in. In other counties, it's still done at the local level. The state doesn't have the wherewithal to come in and take over your operation, nor will they. But they have the power under the executive order that the governor has, or the emergency powers, to have these zones. And so what happened in the other counties is that in Orange County and Rockland County, Ed Day and Steve Newhouse, their county executives, talked with the governor. They told the governor, this is what's going on. Here's where we think we can move the needle a little bit. They had very specific issues to specific municipalities driven by specific members of the community that lived in those areas. So that mitigation's a little bit easier. Here, you have an uptick in community spread. Even if you got rid of, say fast forward, say this is 3 weeks from now, SU's done, we pick up 24 cases. Instead of having 149, we have 125. We still have a problem. You say school goes remote. Okay. 8 cases maybe out of our 18 go down. We still have 117 because we have 10 people who are going to the building still who they had COVID, right? So, because they're out in the community, the adults. So 117, eliminate those two things. We still have 117 cases. So what we got to do is we have to identify where it is now, where it's hiding from us and spreading. That's the testing. Then part of that is enforcement, where there is gatherings. We've been doing that. We picked that up last weekend. We're going to do it again this weekend. We're going to continue to do that. If there's not, and part of that then is targeted testing in these areas that need to be enforced because cases are being driven there. And if we don't get support from the businesses with their employees, that's a message that we're receiving then, that more regulations are needed.
Will you advocate to the governor to reduce the gathering limit?
I think it's something that I think it makes more sense than limiting capacity, going from 50 to 25% capacity at a restaurant who's doing the right thing is punitive. I think the gatherings are more of an issue, and I think if you limit that number for a targeted period of time, I think that's something that is going to have a bigger impact. We can go and enforce these businesses. These businesses can work with us and get all their employees tested rapidly, so they're not waiting days. They find out right then, and we can then address that. So at least we know that it's not the employees spreading it to the community at that point.
Do you really think a legal definition from the governor will affect these parties, though? I know a lot of people that even though 50 is the limit, they're not going anywhere near 50 people. Yet you still see some people saying, well, it's allowed, so I'll do it. So do you really think the governor changing the maximum number will discourage people from doing it?
Some of these aren't your typical parties. Some of these are just people getting together, right? And so, and they're well-intentioned. We were all doing it. We were all in the summer. You get together with some neighbors. You're in the backyard. You got your kids running around, aunts and uncles coming over. Do I think, now if you do all that indoors, there's more risk with that, and we're seeing cases. So I think even though if you limit the gatherings for a targeted period of time in this effort, I think that's something that I think should be on the table. And I think right away people will listen.
Ryan, how will a one-time test of hospitality workers change things?
We'll identify who's got COVID right now. We have to stop the bleeding. So, and it may not be one time.
What conversation have you had with some of those restaurants and restaurant owners about their employees going to work sick and maybe the employees being nervous about not getting a paycheck that day or going forward?
I think that's the dilemma, Trish, right? I think if you're talking to somebody who gets sick and you say, why'd you go to work? They're probably going to tell you just what you said, right? And so I don't have an answer for that, other than I know that if you're sick, you can't go to work. There's not, you know what the answer is? And maybe the business owners need to work with something in the way that tips are done or whatnot for folks like that who get sick so that they can still get some of that money. I don't have an answer for that. I can't solve that at the county level, but I do know that is what's driving cases. We have restaurants now that had one person get sick. The whole staff got sick. They're not open right now. So nobody's getting paid. Nobody, right? Nobody. So this isn't, there's a lot more than one case. So I think that's something we can control. You can't control if you're just out and about and you're exposed. That's not your fault, right? But when it becomes your control is when you have symptoms and you're sick and you know you could have COVID and you don't get a test and you go and you see mom and dad and you go to work and you go out to eat. That's under your control. And we've seen that too many times.
Why wait for the governor on Monday? Why not set a limit on gatherings?
I'm not going to
weekend
get
right
out in
now?
front of the governor on what some of the things he's thinking about. We'll have the conversation, he and I and his teams and our teams, and figure out what it is.
Could those days of waiting do damage this weekend?
We're out enforcing things anyways. So I don't think I've not yet spoken to the governor. I heard him talk about my county and towns and municipalities in my county. We need to have a conversation about what their thoughts are. I can share with them data on the ground that he doesn't have, information he does not have right now, and then we can give our input, and he has the authority to do some things that I don't.
When
Ryan,
was
you
the
mentioned-
last time you did speak to the governor?
Not for a while.
Ryan, you mentioned seeing microclusters in the businesses, hospitality specifically. What would you say to the business owners? Would you like them to take it upon themselves to maybe pause operations if they see fit?
What has happened is the business owners have been good once they've had cases, shutting it down for a couple of days, getting things deep cleaned, working on getting their staff kind of work back up. I don't want businesses to stop operating. I don't want them to even have limited capacity. But what we have to figure out now is how we get employees not to come to work sick. And in that industry, it's difficult because a lot of their compensation is based off of being physically there, right? So I don't know that industry well enough to come up with a solution. But there's a direct correlation. For a long period of time, there wasn't. There's a lot of outdoors. The weather was there. We beat the virus back. We starved this thing. And we didn't have an issue. We have an issue now. It's in the community. So anywhere where there's larger gatherings and where you're indoors, there's more risk now.
And over the past couple weeks, you've been using the phrase like people have let their guard down. Have you thought about rethinking your messaging to people, making it harsher, making it harder to maybe get that out to them better? If people are, I mean, the numbers show that obviously people aren't following it the best.
I don't know. So I think in the beginning of this, one of the advantages we had every day is we would get together every day, and people were at home, and so they would tune in and so your messaging went a lot further every day. Now a lot of these folks are working. They're sick. They're tired of this virus and this pandemic. They are maybe modifying their behavior slightly a little bit with some of their decisions now because they've been hearing about it more and more. But the virus is out there so much more now that you need to kind of make stronger modifications to the way we interact again. And so certainly we had Halloween. We know there was Halloween parties throughout the community. We'll start seeing some cases there. We maybe already are starting to see some cases. So we got to get through this. We have to grind this out as a community. And right now, with elevated cases like this, if we continue at the rate we're going now, in a week from now, we'll have 700 new cases. We'll have 1,200 active cases times 7 to 8% equals how many hospitalizations? Then your hospital numbers are getting stressed. And if it gets worse from there, then you have a real problem. So I think we need to re-engage now, or else the state's coming in with restrictions that nobody wants, bottom line. So I think we have an opportunity to work with the state on surgical and targeted things right now. But if the community doesn't want to respond, there will be more restrictions, and they will be broad-based.
You say re-engage. Don't you think that if people aren't doing the right thing, it's either because they're living under a rock or intentionally rejecting advice and believing in this virus?
I think there's been some other things going on. I'm going to give the benefit of the doubt to the community, right?
That's nice of you.
Yes, so there's been a high-profile election going on, kids getting back to school, people's jobs having to be done differently, worried about money, worried about furloughs. There's things going on that people just haven't had to deal with. So they've had a lot going on. We had a lot of success. And so now our data is back to where we were in June, mid-June. So it wasn't the end of the world in mid-June, but we were focused and we were moving forward and getting better. We've been going backwards. Now we got to stop. We can't get back to May and April. We can't. That's a lot, and people's that would give the state enough reason to want to, instead of having surgical mitigation, want to do more. That's for sure.
What won't you let the governor do?
I think the governor in this can do a lot of things, even if I don't like it. I will encourage mitigation based off of data and what we're seeing. And if there was one thing that we could have done to stop this, we would have already done it. We would have already done it.
Ryan, just to clarify about Cicero, is there anything going on there that makes that town stand out from anywhere else?
No, just looking at their active cases per 100,000, when you look at it that way, which maybe that's how they're looking at it.
But I mean, it's not higher than Geddes.
Barely higher than Geddes, yeah, barely higher. And Lafayette's higher than that, but Lafayette's got 10 cases. You got 10 cases, you don't have a problem, right? Fabius is higher. They got 5 cases, right? So Cicero, I don't know why. Again, I think the governor probably gets a number, cases per 100,000 maybe, and it looks high. So we've looked at it. There's nothing. There's no cluster specific to that other than we have community spread. The Syracuse number, 262 active cases out of the 709. I'd say probably 20% of those are college kids. So that kind of skews the data there a little bit. But again, if there was something surgical we could do right now, we'd do it.
You mentioned, though, you can't figure out what potential clusters are in that community. Why Cicero, though? Why do you think it's in that? Why do you think,
There
he
is no
specifically
clusters in
referenced
Cicero, in our opinion. There's just community spread. So there's families who get COVID the same way everybody else gets it, and then their children get it. Cicero is a suburban neighborhood for the most part. And so we don't think there's much of a difference between Cicero and Clay or DeWitt or Manlius. It's in the community more. So when you can't find it at a micro level, what are some of the macro approaches you can take, and what are some of the common things around here? Is where they're getting it, and they're going to work sick when they have it, and that's leading to more cases. And then also the where tells you some industries, right? And then it tells you some gatherings. So that's where I think you have to target the mitigation.
You had a control room call yesterday. Did you have a heads up that the governor would invoke the words Onondaga and microcluster today?
No. We didn't talk about that. We went over our data, we've been requesting some more of these rapid tests that we start on Tuesday, and I think we're going to get them.
Did you think it was coming, though, from the governor?
No, I knew if the data continued to go this way, you're going to get on the state's watch list if your data goes up. And I've been saying that here, right? That's no secret. There's still communities that have a bigger problem than we do, but we have a problem. And so it merits a conversation with the governor.
Would you fill in the blanks on the testing so people know? Anybody, as long as they register, can go to the FSHED Monday. There's an asymptomatic option, which is the nose.
Yes.
swab. Then there's the symptomatic option, which is either the nose or if you register the nasal swab.
Yeah, either the swab or if you register the saliva
I
with
meant oral
upstate.
swab, not nasal swab. Too many swabs. And then it's rapid testing at the On Center,
We will be doing a rapid test here for the hospitality industry on Tuesday.
and that means you'll invite them by business, or if they are part of that group. they
We're
can
working
come.
with industry partners. We're going to have a registration option up and running this weekend, and then we're going to want people to pre-register for that. And certainly, if we'll meet the demand, whether that goes Tuesday, Wednesday, Thursday. If we have to, that's what we'll do. We'll meet the demand.
And that's the kit you showed us a few weeks ago?
Correct.
What can you tell us about the cluster at higher ed institution?
I think there's more cases in it now. I don't confirm. I don't know how many, but I believe that there's more than one now.
Are you concerned at all about Syracuse University hitting that 100 case threshold?
They
I know
did not.
today's
They
the
did not
last-
hit it. That's good. There was a couple gatherings that helped push some of those cases, so we'll probably continue to see cases coming from that. The students, for the most part, did a very nice job this semester. There's some lapses there, and certainly the break's coming up. So I think Syracuse University already had planned not coming back after Thanksgiving. SUNY's now doing the same thing. Will that present a little bit of relief with cases? A little bit of relief, but what it does is it takes out some risk, right? Think about it, Syracuse University wasn't a good partner. 18,000 kids, if they weren't so good at what they did this semester, there's risk there. But they're very competent and they did a great job.
What's the strategy using rapid testing for the hospitality? Because you could use saliva pool sampling, you could offer them regular few-day testing, but
So
you want them
it's-
to walk out of here knowing.
I want to know, so we box it all in. And so we know then their isolation starts and that we're boxing in risk, which, because they work in settings that have proven to be less controlled than some of the other settings that we've been doing proactive testing in.
Do you fear that virus is spreading in restaurants and bars as we speak?
We've seen it. We've seen it go through employees. And I'm not going to call the restaurants out. It's not, but many restaurants take pauses, and that's no coincidence with what's going on in the pandemic.
Should they have to be like nursing homes were and have to have employees pass tests?
I have no
Like-
problem. I have no problem going there for that if we can get the resources. There's no way that your small business owner could be on the hook for having that type of testing protocol. But if we can continue to get the resources, that's an industry that critical to keep it going for our economic recovery. Very critical. At the same time, it has to be, the rules have to be enforced, and we have to know for them to have success that people aren't going to get sick when they go to their business. So that's something that if we have the resources, continuing to provide testing for the hospitality industry is something that I think is a good idea.
What I wondered too is the rapid testing help them know whether they can go to work or not go to work like that night? I mean,
We'll know in 15 minutes if they have COVID.
right, so is that your strategy? You're seeing people that know they're sick going to work.
So these are asymptomatic tests, so they don't know they're sick. If they are sick, it is on them to do the right thing for their colleagues, themselves, and their own health and their community, and still get tested.
Are you still doing asymptomatic teacher testing? How's that going? Is that
We are. We've only had one pool that's been positive, and that pool, I think, only had one positive in it. So yesterday, I think today we're in Fayetteville. Manlius today, doing it out in Fayetteville. So we've had. So again, we focus a lot of our testing around going back to school. There are kids, teachers. We know people are going to be in close proximity. Easier to regulate the settings, but we're doing quick symptomatic testing and asymptomatic screening. We're having more success in circumstances that otherwise we wouldn't have a lot of success. So now we're looking at these other industries that are now being driven back indoors with more connectivity, and And so getting the employees tested more and trying to build up a program there is what we're looking at. And hopefully that will draw for these types of businesses to have more success.
I might have missed this detail. Which higher ed institution had the 24, the cluster?
One was a faculty member. I think 23 of them were at Syracuse University.
And what's been the outcome so far of the upstate medical residence party?
I think we have more than one now, but I don't know the numbers yet.
Not a large number.
No.
Central New Yorkers have been very lucky because they've been able to get direct information from you and the governor. What are people still missing? What have people not gotten through their minds in order to affect their behavior?
Andrew, it's tough because I'm up here and I'm very biased with that because I'm saying the same things over and over again sometimes, and I think you're listening to the same things over and over again, but that's what's happening. We're a source of information, then we have to make decisions. We found in round one, the best thing was to arm the community with all the facts and where the risk is so that they can mitigate that for their own families, and they did it very well. Now I know they're tired and maybe they don't want to believe it's here the way that they once feared it was here, but it is here, and people are getting very sick. 9 people got very sick yesterday and are in the hospital right now. You don't go to the hospital unless you're very sick. You avoid the hospital at all costs unless you're very sick. So we got to take this seriously because it could impact everybody who gets sick and needs the hospital. And so even if you don't believe in this virus, people are getting sick, they're going there, and your loved one can still need the hospital bed for something else, and it might not be there for them if this thing gets too out of control. So we got to level this off with the cases. That's what we're working on now. Identifying all the exposure so we can get it done, box it all in, and then certainly part of that will be enforcing gatherings that are out of compliance, and that may mean more strict guidance coming from the state. Those are the conversations we'll have with the governor, but we think obviously targeted and surgical approaches are better than hitting an industry with something, especially when many of people in many industries right now are doing the right thing.
For people who are confused, give them clarity. Should people cancel their plans this weekend?
I don't know if I'd cancel my plans. I would probably do things outdoors and enjoy what could be the last really nice weather for a long time in central New York, right? So I'm not a weatherman. I know that you have very good ones at all your outfits, and they have broad discretion on being accurate with their forecasts at times. So hopefully they'll be giving out great forecasts for a long period of time. But this is a great weekend to go to a park, get a run in, enjoy the outdoors, get the grill going, and if you're going to be with people outside.
I know you haven't had the conversation with the governor yet, but is it likely that come Monday or Tuesday that this county will be in one of his colored zones, yellow, orange, or red?
Well, I think if anything, you'd look at a yellow zone. You want to go to a red zone. There's other counties bigger than us that have a problem double the size of us right now. And the other counties that, when they went into a zone, went in yellow, had much larger problems. But I think, I don't even know if you go into what the yellow zone was for those communities. But I think there merits the conversation to address some of the rules and regulations that are driving cases. And that's a legitimate conversation that we all need to have. And there's certainly certain things that I think in the short term merit being looked at.
You said you're opening testing to asymptomatic people in the community, and you made a comment that it's free, but it will cost you a lot of money. Do you have any estimate on how much that will cost?
$100 a test.
And how long will that go?
We got to solve this problem, so it's going to go until we solve the problem. we're not going back down to 0 or 10 or 20 or 30 maybe, right? It's just not going to happen, but we cannot be at 100, 149, 90, 80. These are just unsustainable numbers.
You have capacity, you have the actual tests to keep going?
The tests aren't the issue there. That's going to be the costs and how many people, again, you may not for an asymptomatic test. If we're going to get 2,000 people trying to register on Monday, that's not going to work. Physically, you don't have enough time in the day. I don't think we'll get that kind of demand. But again, we're scaling all of this up. We're moving the deck of people around that do different things in county government. We did it to help Dr. Gupta out in her end of this. Now Dane Weirs needs help to get his job done and help manage these things. And so these are all things that we're working through. And it's going to cost money.
You mentioned you deployed 20 county workers last a couple days ago to the health department. Have you had to push more over because of these numbers?
Right now, Dr. Gupta is very happy with what she's received. If she needs more, we'll do more. We have people cross-trained. This is all hands are on deck.
How many contact tracers would you say are?
There's over 100 people right now that have some sort of role in that world, but the state Bloomberg program too, once we get to a certain point, we often are now handing it off over to them. There's a lot of work that goes in before they start doing their job. I think you actually have to have the numbers, the names of the people and whatnot done. Then you get them there. So that's a lot of work right there. Then they go and then start their investigation.
So the 100 is just the county's side of it?
Correct.
How many people can you accommodate on Monday if they want asymptomatic tests?
Probably 250 to 300 people. Other questions? Tomorrow's going to be another big number. So hopefully we're not calling you all here tomorrow. If there's something that happens that certainly is worth addressing, we will. But we got to get re-engaged, and we got to do it now. We've been saying that our economic recovery is in jeopardy if we don't, and that's where this is going if we don't get our act together. Okay. See everybody on